Did you know that consuming alcohol during pregnancy can lead to a range of disorders in the unborn child? Today, we're delving into the universe of fetal alcohol spectrum disorder, or FASD. This term encompasses the varied effects that prenatal exposure to alcohol can have on a child, embracing physical, mental, behavioral, and learning disabilities. It's crucial to comprehend that these effects are not confined to a single category, but span a spectrum. This spectrum includes conditions like fetal alcohol syndrome, partial fetal alcohol syndrome, alcohol-related birth defects, and alcohol-related neurodevelopmental disorder. So, is there a safe level of alcohol consumption during pregnancy, you might be wondering? The is a definite no. There's no safe level of alcohol consumption at any stage of pregnancy. Remember, these effects are for lifelong and are entirely preventable. And before we wrap up, we have a small request. Please, subscribe now to join our community. A thumbs up will be a fantastic way to encourage us to keep bringing more interesting, challenging, and high-quality videos to everyone. Our channel, MedSign Health 360, is all set to bring critical, up-to-the-minute, and systematic medical and health knowledge in a simple, easy-to-understand manner to everyone for improved health and a better life. We appreciate your thoughts and would love to hear them, so don't hesitate to share in the comments. Just how prevalent is FASD, you might wonder? Well, let's delve into the epidemiology of this disorder. Fetal alcohol syndrome, or FAS, and fetal alcohol spectrum disorder, FASD, have a prevalence rate of 0.1% and 1% respectively. To put this into perspective, that's 1 in 1,000 for FAS and 1 in 100 for FASD. Now that might not seem like a lot, but consider this. FASD is the most common preventable cause of intellectual disability. That's right, it's preventable, yet it remains a significant issue. This tells us that we still have a long way to go in terms of education and prevention. Now, as we move on to the pathogenesis of FASD, things get a bit murkier. The specific mechanism of FASD remains a mystery to us. However, several hypotheses are floating around. Some believe it could be due to nutritional deficits, while others think it might have to do with the toxic effects of acetaldehyde, a metabolite of alcohol. Then there are theories about the alteration of placental transport, abnormal protein synthesis, and altered cerebral neurotransmitter. But the truth is, we're still trying to piece together this puzzle. And that's the thing about FASD, it's complex and multifaceted. It's not just about the numbers or the theories, it's about the lives it affects. Diagnosis, however, isn't always straightforward. Diagnosing FASD is often a challenge. This is not only because the condition can easily be missed or misdiagnosed, but also due to the intricate criteria that must be met for a diagnosis. Let's delve into this a bit more. For a diagnosis of fetal alcohol syndrome, 3 key factors must be present. First, there's the growth deficiency, which manifests as low birth weight or decelerating weight over time, not attributed to nutrition. Next, we have the characteristic pattern of facial anomalies, such as short palpebral fissures, a flattened philtrum, thin upper lip, and a flat mid-face. Lastly, we look for central nervous system dysfunction. This can include microcephaly or neurobehavioral dysfunction, which can present as hyperactivity, attention deficits, learning disabilities, and more. For alcohol-related birth defects, the criteria centers on congenital anomalies. These can include malformations and dysplasias of the cardiac, skeletal, renal, ocular, and auditory systems. Lastly, we have alcohol-related neurodevelopmental disorder. Here we again see central nervous system dysfunction, similar to fetal alcohol syndrome. Additionally, there's a complex pattern of behavioral or cognitive abnormalities that can't be explained by familial background or environment alone. One vital piece of evidence across all these diagnoses is maternal drinking during pregnancy. This is the common thread that ties these conditions together under the umbrella of FASD. While there's no cure, early diagnosis and management can significantly improve outcomes. This underscores the importance of understanding and identifying these conditions as early as possible. How do we manage a condition like FASD? Fetal alcohol spectrum disorder, or FASD, unfortunately has no cure, but don't let that dishearten you. The key to navigating this condition is early diagnosis. Why, you ask? It's because early diagnosis can help prevent secondary disabilities that might arise. Now, it's essential to remember that individuals with FASD and their families don't have to face this journey alone. There are numerous community resources and services out there, ready to lend a helping hand. These resources are not just helpful, they're vital. They play a significant role in improving the outcome for those living with FASD, So, while it's true that managing FASD can be a challenging task, it's crucial to remember that it's not an impossible one. With the right resources, support, and a proactive approach, individuals with FASD can lead meaningful lives. A life with FASD may be challenging, but with the right resources and support, it's far from impossible.